Anatomy of spleen. The spleen is the large encapsulated complex mass of vascular and lymphoid tissue situated between the fundus of the stomach and diaphragm. So the spleen is located in the left hypochondriac region anterior to 9th, 10th, 11th ribs. So here is the lateral view of the thoracic and abdomen region and showing 9th, 10th and 11th ribs covering the spleen. We know the spleen is now located in the left hypochondriac region anterior to 9th, 10th, 11th ribs, which makes it more vulnerable structure during rib fractures. So if there are rib fractures, the spleen becomes more vulnerable structure due to rib fractures. Normally, spleen does not extend beyond the level of costal margin. So, we cannot palpate it unless it is in splenomegaly. Accessory spleens occur in 20% of the population and are commonly located near hilum and tail of pancreas or within the gastrosplenic ligament. Characteristic features of spleen: it is a coffee bean shaped intraperitoneal organ. The adult spleen is usually 9 to 14 centimeters long and 6 to 8 centimeters wide and 3 to 5 centimeters thick. The average adult weight depends on the volume of contained blood. Emptied of blood, it weighs between 7 to 120 grams, whereas in vivo, spleen weight ranges from 150 to 350 grams. The spleen has two poles, superior and inferior poles, and two surfaces, diaphragmatic and visceral surface. So here is the superior pole, inferior pole, the diaphragmatic surface in relation to diaphragm, and here is the visceral surface. This is the left dome of diaphragm. So usually the spleen is not palpable as it lies deep in the ribcage, but it may be felt in the individuals with slender build or those with splenomegaly. So here in this first image we can see the location of spleen. So the inferior pole of the spleen, it is not been palpable in the first image. In lower image we can see due to splenomegaly it becomes palpable. So in this image we can see the diaphragmatic surface. And this is the visceral surface. So the spleen has only a thin capsule and it is well vascularized organ, so making it susceptible to injury and rupture, especially through trauma to left lower ribs. And splenic rupture should therefore always be considered in blunt abdominal injuries. Let's see the structures related to the spleen. The spleen is related to the diaphragm on posterior aspect. So here is the left dome of diaphragm related to the posterior aspect or diaphragmatic surface of spleen, and visceral surface is related to the stomach on its anteromedial side. The stomach is removed here. So here the stomach is related, which is called as gastric impression or gastric area, and spleen is related to the left kidney on its inferomedial side. And also above to the left kidney is the left suprarenal gland. And we can see cut end of stomach to expose the relations of spleen, and it is related to left colic flexure on its inferior aspect. Left colic flexure is otherwise called as splenic flexure because of its relations, and spleen is also related to the tail of pancreas at the hilum of the spleen. And to remember the dimensions and relations of the spleen, it is easy to remember with a dictum like odd numbers of 1, 3, 5, 7, 9, 11, means the spleen is 1 inch thick, 3 inches in breadth and 5 inches in length, and weighs around 7 ounces and lies between 9th and 11th ribs. Ligaments of spleen. The spleen develops between the leaves of dorsal mesogastrium, and so it almost entirely invested with visceral peritoneum. So that is firmly adherent to the capsule. So gastrosplenic ligament, it is the fold of peritoneum that extends from the greater curvature of the stomach to the splenic hilum and contains short gastric vessels. So here is the cut end of stomach, greater curvature of stomach, and we can see gastrosplenic ligament, which contains short gastric vessels, and it connects the spleen to the greater curvature of the stomach. And ligament contains the short gastric vessels and also gastroepiploic vessels, and it separates the greater sac and the lesser sac. So the next, regarding the splenorenal ligament or lenorenal ligament. Splenorenal ligament contains splenic artery, splenic vein and tail of pancreas. So we can see the tail of pancreas here ending near the hilum, and this is the splenic artery and splenic vein, which are the contents of splenorenal ligament. So here is the left kidney. Forms the splenorenal ligament, which contains the splenic artery, splenic vein and tail of pancreas. The only intraperitoneal part of the pancreas is located within this ligament. Anterior end of the spleen is held up by phrenico-colic ligament. So phrenico-colic ligament connects with the diaphragm and the colon. So we can see the anterior end or the inferior pole of the spleen. It is connected to the splenic flexure of colon by means of phrenico-colic ligament. So this phrenico-colic ligament holds the spleen from anterior end. And phrenico-splenic ligament, it runs between the spleen and the peritoneum of undersurface of diaphragm. So between the spleen and the peritoneal reflection of the diaphragm is called as phrenico-splenic ligament. So let's talk about the functions of spleen. So hematological and immunological functions like hemopoiesis, maturation of blood elements, immunoglobulin activation, recirculation of T and B lymphocytes. Production of leukocytes, peptides, immunoglobulins, that is IgM mainly, and opsonins and tufsin and properdin, and it also helps in production of some factors like complement factors and stem cells. And spleen is a storage organ for leukocytes, platelets and all metals. And it is a clearance organ where it removes the microorganisms, parasites, circulating antigens and altered circulating cells and circulating foreign bodies and even the senile RBCs. Synthesis and metabolism. Spleen is an important precursor of hepatic functions. and it also helps in the metabolism of lipids, cholesterol, bilirubin, amino acids. And spleen controls the bone marrow, mononuclear phagocytic function, and also somatic growth. Blood supply of the spleen. So the main arterial supply is by the splenic artery, the largest branch of celiac trunk. So here is the celiac trunk. Celiac trunk arises from the abdominal aorta. So we can see this tortuous artery is the splenic artery. So splenic artery is the largest branch of celiac trunk and has a tortuous course, and it runs along the superior border of pancreas to reach the hilum of spleen, where it branches into central and peninsular arterioles and gives vascular supply to the organ. Branches of splenic arteries. So not only it supplies the spleen, it supplies the stomach by short gastric arteries, left gastroepiploic artery. And the splenic artery supplies the pancreas by means of dorsal pancreatic branch and great pancreatic branches of splenic artery. And it also gives rise to few caudal pancreatic arteries and end with finally about 5 terminal branches. So it finally ends with 5 terminal branches which are near the hilum of the spleen. So the 5 terminal branches of the splenic artery are clinically important because they supply the individual segments of the spleen with no anastomosis between them. So they are the end arteries, so that the obstruction or ligation of any terminal branch will result in a splenic infarction. That is, spleen is very prone to infarction. Next, regarding the venous drainage, the splenic vein. Splenic vein is the vein which is along with the splenic artery, and the blood from the parenchyma of the spleen is collected by the trabecular veins and they join to form segmental veins and they drain the individual splenic segments. So segmental veins join to form 2 superior and inferior or 3 superior, middle and inferior, which are called as lobar veins. So segmental veins, they will join to form 2 veins, they are superior and inferior, or they may join to form 3 veins which are superior, middle and inferior lobar veins, and that emerge from the length of the splenic hilum and unite to form a splenic vein within the splenorenal ligament. And at the hilum of the splenic vein meets the superior mesenteric vein to form the portal vein. So we can see at the neck of the pancreas, we can see posterior to the neck of the pancreas, the splenic vein is here, which is draining the spleen, and here is the superior mesenteric vein. And these 2 joins to form portal vein. So veins that empty into the splenic vein are short gastric veins which are draining the posterior wall of the stomach, and also the left gastroepiploic vein, pancreatic veins mainly from the body and tail of pancreas, and inferior mesenteric vein. Splenic vein thrombosis is most commonly associated with pancreatitis and shows clinical signs like gastric varices and upper gastrointestinal bleeding. Now we shall talk about the lymphatics of spleen. The lymphatic drainage of the spleen begins in the white pulp. So the lymphatics travel with the blood vessels towards the lymphatic subcapsular plexus, which drain via the larger lymphatic channels to lymph nodes at the splenic hilum and around the tail of pancreas. So we can see the lymph nodes in the splenic hilum. Lymph nodes at splenic hilum and around the tail of pancreas. So from here the lymph drains into suprapancreatic and infrapancreatic lymph nodes. From here we can see the lymph nodes are suprapancreatic, and here are infrapancreatic, and also drains into omental lymph nodes which are on the posterior side of the stomach. So omental lymph nodes, and finally they drain into celiac nodes and cisterna chyli. So here are the celiac nodes. This is the suprapancreatic nodes. Here is the celiac node which is near the celiac trunk. So all the lymphatics drain finally into the celiac nodes, and from the celiac nodes the lymph is drained into cisterna chyli, and which continues above as thoracic duct. Innervation of the spleen. The spleen is innervated by both the components of autonomic nervous system, that is the sympathetic supply is dominant, and spleen receives postganglionic sympathetic fibers from celiac plexus. So celiac plexus are around the celiac artery, and parasympathetic nerves from vagal trunks. So parasympathetic nerves is by vagal trunks, and sympathetic fibers innervates the arteries at least to the trabecular level and have major influence on the blood flow within the spleen. The capsule and parenchyma are innervated by sensory fibers that convey pain. Referred pain from the splenic pulp is poorly localized to the epigastrium. Microscopic anatomy of the spleen. The spleen is made up of red pulp and white pulp separated by marginal zone. So red pulp is composed of splenic cords and sinuses. So splenic cords composed of reticular meshwork filled with the blood, which is an open circulation system, and that filters the blood from the damaged erythrocytes. Splenic sinusoids consist of long vessels with a fenestrated ring-like or barrel hoop near the basement membrane that prevent old or malformed RBCs or platelets from re-entering the venous circulation. So what is this open circulation? So blood empties from the sheathed capillaries into the splenic cords and then enters the sinusoids through slits in the vessel wall. And what is the closed circulation? The blood empties from the sheathed capillaries of red pulp and directly into the sinusoids is considered as closed circulation. So spleen is containing both open and closed circulation as well. Macrophages, which are found in the cords and around the sinusoids of spleen. Macrophages do the phagocytosis. So phagocytosis of damaged RBCs, platelets that do not re-enter the circulation. So the iron produced by this degradation is stored by the macrophages and returned to the bone marrow. Meanwhile, the toxic bilirubin is excreted into the liver. The capture of viruses and opsonized pathogens that enter the red pulp is also done by spleen. So let us understand the blood flow inside the spleen. So we know the arterial supply is by the splenic artery. So here we can see the splenic artery. Splenic artery divides to form arterioles. And these arterioles end up in the red pulp. And from the red pulp, the blood flows into cords or sinusoids. From the red pulp, the blood flows into the cords and sinusoids. And from the sinusoids, it is connected by the venules. And from the venules, the blood is drained via the splenic vein into portal circulation. White pulp, periarteriolar lymphatic sheath, which is shortly called as pulse, is called as the white pulp, which surrounds the arterioles. So around the arterioles we see the white pulp. So white pulp composed of dense lymphoid tissue mainly containing T lymphocytes. Follicles, that is the lymphatic follicles. The main components of white pulp are the lymphatic follicles, and which are in close association with arteriolar lymphatic sheath, and contains B lymphocytes. Marginal zone. Marginal zone is located between the red pulp and white pulp. Contains the antigen presenting cells like macrophages and specialized B cells, which are called as marginal zone B cells. Let's see some associated clinical aspects of spleen. Splenic rupture. Because of spleen has such an extremely thin capsule, it is susceptible to injury. Even when there is no damage to surrounding structures, and because of the spleen is highly vascular, when ruptured it bleeds profusely into the peritoneal cavity. So splenic rupture should always be suspected with blunt abdominal injury. Current treatments preserve as much as the spleen as possible, but some patients require splenectomy. So this completes the normal anatomy and clinical aspects of spleen. Thank you.